Hello everyone. My name is JR. I'm here to present to you guys about regarding vulnerability. This is the lucid chart that I made, how education, socioeconomic status, nutrition, access to healthcare, stress, and prejudice are contributing factors to vulnerability, where individuals are very high risk to develop poor health. As you can see, education is very important in preventing certain diseases. If individuals lack of education, they tend to have increase in stress and may develop poor nutritional habits, which can lead to vulnerability. Moreover, low socioeconomic status can contribute to lack of access to health and lower educational levels, which can also lead to vulnerability. Also, stress can lead to poor nutrition and vulnerability. Additionally, when prejudice or discrimination exists in healthcare, it causes stress, creates barriers in regards to access to healthcare, which can also lead to vulnerability. Now I will present my little presentation about vulnerability with PowerPoint. Risk factors to vulnerability. First, I will talk about economic status. According to Adler, Newman, 2002, socioeconomic status, whether assessed by income, education, or occupation, is linked to a wide range of health problems, including low birth rate, heart disease, arthritis, diabetes, and cancer. Education is the most basic component of socioeconomic status. Education is the second risk factors. When it comes to public health, education is extremely important. According to Hammond, 2016, health education goes beyond merely discussion physical health, as it also touches upon how to remain mentally and emotionally well. It encourages people to improve as well as maintain their own health, as well as the health and well-being of others. When the individuals from the community lack of education and knowledge about certain diseases and preventions, then they are at risk of developing poor health. For example, if an individual doesn't know that long-term effects of smoking and drinking, then he or she is very at higher risk of developing heart diseases and lung problems. Nutrition. And the third one, according to University of Minnesota, public health nutrition strives to improve or maintain optimal nutritional health of the whole population, and high risk or vulnerable subgroups within that population. Poor nutrition during pregnancy, infancy, childhood, and adolescence can significantly contribute to poor physical, mental, and social well-being. Coronary heart disease, some types of cancer, stroke, type 2 diabetes, and atherosclerosis are associated with dietary factors. Low income, some racial and ethnic minority groups, and people with disabilities are at higher risk for nutritional problems. Fourth, access to healthcare. According to Healthy People 2020, access to comprehensive quality healthcare services is important for promoting and maintaining health, preventing and managing disease, reducing unnecessary disability and premature death, and achieving health equity for all Americans. Barriers to health services include high cost care, inadequate or no insurance coverage, lack of availability of services, and lack of culturally competent care. These barriers lead to unmet health needs, delays in receiving appropriate care, inability to get preventative services, financial burdens, and preventable hospitalizations. Fifth one, stress. Stress affects everyone. Long-term stress can harm health. When it becomes chronic, it can suppress the immune, digestive, sleep, etc., which may cause them to stop working properly. Prejudice. According to Kohler 2017, research suggests that discrimination is internalized over a lifetime and linked to a variety of poor health markers and outcomes: more inflammation and worse sleep, smaller babies, risk of cancer, depression, and substance abuse. And these are my references. And thank you for listening. Have a great night.